Hey, my name is Dr. Rogers. I'm at Pediatric Associates of Savannah in Savannah, Georgia, and I'm excited to answer some questions for you guys today. So, picky eaters are exceptionally common. It's usually reassuring to a lot of my families just to let them know they're not alone, and that is something we see all the time. And kids end up doing really well. They get better, and they usually grow and thrive. A couple things I like to try to encourage, because unfortunately there's not one magic phrase that's going to make a kid stop being a picky eater, but there's things we can work on. One thing I like to encourage is to make sure that families are eating together as a family, that we have dinner time as a family. Over time, kids will usually mirror their parents' eating habits. Another thing is avoiding food fights. It's a struggle. It's frustrating. It's maddening. But when you start making food a battle, it usually is not going to end well for the parent or the family. Just be consistent and try your best to provide good options. And as long as your kid's growing and thriving, they're usually going to end up being okay. Just keep providing good options. And if you do have that concern, bring them to us. Let us look at that growth curve. Let us do a good exam and make sure that he is doing, or she is doing, what she's supposed to do. Another thing that's easy to do, but usually doesn't have a good positive lasting effect, is bribery. It's kind of short-term gain, but you don't get a lot of long-term positive effect from that. So try to discourage that a little bit if we can. And then my favorite term I like to use when going through these picky eaters is be consistently inconsistent, meaning continue to provide a consistent, good variety of food options. That is going to help you out in the long run. And then the last thing that I see parents run into sometimes that gets them in trouble down the road is every time that kiddo refuses to eat. And as parents, I'm a parent, we're going to lose some battles every once in a while. And that's part of being human, but don't replace that one food with that one thing every time. That's how you end up getting the only eating corn dogs, only eating chicken nuggets. So make sure that if you are going to replace that, make sure you're replacing it with a variety of different options as well. But try not to make special meals for one kid at the table if you can. So the answer is, my daughter is only about 16 months right now, so she is not eligible. I can tell you that in our practice at Pediatric Associates, every doctor who has a child eligible has already gotten their child the immunization. So if that tells you anything, we not only believe in it, the science and the FDA and the CDC and the regulatory bodies have done a lot of good research and provided the information to say that this is a safe vaccine for kids. So I absolutely, when it becomes available for my daughter, I will plan on getting it. Me and my wife are both vaccinated as well. So yes. This is a great question. It also is a very broad question. What's the best way to discipline my child? You can go online and find about 1,000 different books that will tell you, okay, this is how you do it. This is what's going to be the best way to do it. From my experience talking to parents, I would say I don't have one exact answer to say, okay, this is how you're going to discipline. But I can tell you the things that I see in good situations. And number one is consistency. When a kid knows what his expectations are, when we do decide to do discipline or rules, what happens when we don't follow those? How do we handle that situation? Trying to be consistent is going to be your best friend down the road. In regards to different techniques, the one thing I do like to mention in the situation that we're learning more and more about as things are studied over time, corporal punishment, physical discipline, does not have lasting effect when compared to a good, structured, positively reinforced or timeout-based discipline technique. Corporal discipline has only really shown that over time, it can lead to more aggressive behaviors in late childhood, early adolescence, and young adulthood. So comparing the two, if done consistently, there's no positive benefit to that in that sense, if you will. So being consistent and, having a kid know what his expectations are when it is time for discipline. When mommy says this is what's going to happen, is going to be your best bet. What is the best age to start swim lessons? My guy is 18 months old. I feel you right there. I tried to take my daughter to the pool yesterday and just have her in my arms, and she's 16 months, and she was not a fan in any way, shape, or form. So, and that's not an uncommon situation. So there is not one exact age. When you look at kind of what the American Academy of Pediatrics stands on swim safety and when to start, it can be in certain situations anywhere from 1 to 4 years of age before individual kids are ready. You want to look at their physical abilities, like are they good, steady walkers? I wouldn't recommend doing any swimming on a kid that can't walk yet, but not only just physical recommendations, but kind of the mental, emotional aspect of it. My daughter's in this phase where she's terrified. So I don't consider her quite ready yet at 15 months to have a true swim lesson. But again, some kiddos are, so it's getting a vibe for how your kid responds to things, and make sure that if you are going to do this, do your research, find a reputable swim instructor, talk to some other moms that have been doing this or have already done it. But from my standpoint as a pediatrician, one of the saddest things I see are incidents of sometimes drowning. And I was actually having a conversation with my mother this morning, and a kiddo from my hometown had drowned. So it's something that's near and dear to my heart after taking care of kids for so long at this point. I've seen a lot of unfortunate events. The most important thing I can say about swim lessons is swim lessons are a great layer of protection, but they are in no way, shape, or form something that's going to make a child drown proof. So the number one thing is parents have to be on it all the time. Someone is constantly watching those kiddos. But back to your original question, is somewhere between 1 and 4 years of age is what the American Academy of Pediatrics would say is appropriate, but it is very child dependent. In my experience, some kiddos are just more predisposed than others, it feels like, but there are a couple things you can try. And your goal in regards to when you're dealing with this is prevention. So trying to keep it as dry as possible. When he gets out of the pool, make sure that you can kind of tug down on that earlobe, tilt your head to the side, drain that out, get a towel in there immediately. Try not to let them sit with that in there. Earplugs can kind of be a double-edged sword, so you want to be careful. Sometimes they can kind of keep some moisture in there. There are certain custom molds that if you're going to use a plug, I would probably recommend over just a random earplug, but that can depend on where you live, what type of access you have to that. But generally speaking, it's keeping it dry as best you can, dry as soon as he gets out of that pool. And if you do have some concern, there's some old school techniques that you can talk to your pediatrician about that might include some little white vinegar and maybe some alcohol. But I'd encourage you to talk to your pediatrician one-on-one before you do anything like that. And of course, if you feel like your child is having pain or discomfort, I would definitely recommend they be seen. Sometimes a good treatment for swimmer's ear can help prevent it moving forward as it clears out any bad bacteria that's living in that canal there. So to answer this, I'm kind of going to not just address video games, but screen time in general. So that's going to include your video games, your tablet, your TV, your movies, stealing that cell phone for mom or grandma. So when you look at it, the American Academy of Pediatrics recommends children younger than 18 months try to avoid screen time, period, if at all possible. And then when you start looking 18 to kind of 2 years of age, they recommend that when they do have screen times, it is only with a parent, a guardian, or an adult, and they're viewing quality programs that are high yield, and still limit that time to less than an hour a day. And then when you start talking 2 to 5, so that toddler age where your child is, looks like 3. So no more than an hour a day is what's recommended. And it is recommended to do high quality programming, meaning, mine mindless video games might not fit in that high quality program area, but as much as you can, if they're going to be on that screen, you're engaging with them. And we know that it's some type of educational technique. That's really the goal that we're looking for in that age range. Things that I like to focus on if you do get them into pre-K, the teachers are great at what they do. They're going to get these kids moving in the right direction. So try not to worry too much about what to do to prepare him, because that's what it's there for. That's what pre-K and preschool and kindergarten, those are all there to find these kids that are at this very beginning of development and learning, and to start with them where they're at and work their way up. And they do a good job of that. But just the simple things, working on trying some socialization, especially in the COVID era. My daughter is a product of the COVID era, it seems like, and she's terrified in public. So trying to teach some sharing concepts if you have the ability, and then going over some of the simple things that we talk about with you usually at that 3 or 4 year visit, working on some colors, working on some shapes and just numbers and counting and maybe letters, if you will. And your kid's going to be great. That's one thing I've seen a lot of parents get really worked up, and all of a sudden a year later, the kid's doing awesome and they're going to continue to do awesome. But if you have concerns is he ready? Is he behind? Please come see us, give your pediatrician a call. We are happy to check and evaluate that at any time. So that is a great question that we unfortunately get all the time. I was just talking to my sister-in-law who has about a month and a half old baby that she's trying to do this exact thing. We had this conversation yesterday. What do you do to make these kiddos sleep in their bassinet or sleep in their crib? And it definitely depends on a multitude of factors. First, being their age. I'll start with kind of a newborn, this early infancy. It's tough. Sometimes it just takes them getting used to spacing out feeds, what they tend to do as they naturally get a little bit bigger. But what we did is with my daughter, and something that I like to use as a pediatrician, is you want to create a sleep space for this infant where they know this is where I sleep. This is my safe sleep haven, if you will. This is what sets up sleep time. So I like using either sound machines, or me and my wife and my daughter love the little shusher. It makes some shh noises for her, and getting the lights down and keeping it nice and calm in there. And then trying to put her down right before she goes to sleep. So as she's sleepy, you can tell they're drifting off. We would put her down in that bassinet so that she starts associating that feeling of getting a little sleepy with the crib. The other thing that we kind of adopted, and there's some things that'll work for some kids and some aren't. One thing we like doing is using some of what's called the S's. So shushing, swaddling, swaying, and suck. So pacifier. The shushing, you can do some shh. I got tired of it, so I bought a little cheap sound machine that makes a consistent shush sound. And to this day, we actually put it in my daughter's crib when she goes to bed right now. So that's your shush. Swaddling, of course, in the newborn period, get those little babies burrito. Some kids love swaddling and it helps. Some don't, and that's okay too. Like I said, there isn't one quick fix for any of these. Swaying. So when they do start getting, you can tell they're getting a little upset, kind of waking up a little bit. This is when those last two S's that I like to use come in, and let them feel your hand on them, but we're not picking them up quite yet. And you can sway, kind of rock them gently back and forth with your hand on their little belly or on their chest, so they know that you're there, that you're giving them that comfort. And then the pacifier, as well, is something that can be used in that situation to try to catch them right before they get too angry and upset. Those all sound great and really beautiful when you say it like that, but doesn't necessarily mean that that's going to work for every kiddo. But the big thing I like to encourage is finding what their sleep space is so that they start associating with that. And it can just take time. Some kiddos will feed every 3 to 4 hours for the first couple months of life, and that can be hard enough right there with a lack of sleep. And then if they don't like sleeping in their crib, that makes it even tougher. But trying to get them used to their sleep space, because at the end of the day, the most dangerous place for a baby to sleep, studies have shown over and over again. And I'm not a terribly old pediatrician, and I've seen the sad outcomes of what can happen with some co-sleeping. So it's something that I love to try to encourage my families to work hard on, but I also know that it is not an easy ask. I have been there in the middle of the night when you got that screaming baby as soon as you get them like a half a centimeter from the bassinet, but trying to be consistent with that as well. For older kids, that one can be a number of different reasons and possibilities, because they're starting to get a little smarter, right? In the beginning, kids need nurturing. So, if that newborn or infant is crying and upset, you do have to get them and love them and pick them up and soothe them. Nurturing is great for their development. It's important. But as they get older, they get a little smarter, and sometimes they start trying to learn how we respond to them a little bit. So the 6 months and older is the earliest that we talk about just crying it out at certain times, depending on certain families and certain kids. Like I said, there's no one size fits all for these different situations. And then the other thing is when they're kind of toddlers, preschool age, when they're getting up, walking, and getting into bed with you, that can get a whole lot tougher as well. But at the end of the day, getting them back to their bed, trying to not let them crawling into that bed and staying there when you want them out as a reward. If you think about it, when they get up and they get in there, that's what they're wanting at the time. And that's because they love them and you love them as well. I absolutely know that. But when we get up, we go back to our bed as best we can. But again, one thing I've learned is I've heard probably 100 different techniques that all can work. Those are some that I like to try. There's other ones as well, but it can be a tough situation, I know. But trying to give them their sleep space and their sleep haven, so that is what happens in that crib or that bed. That's what I try. That's the goal. And how we get there, it can vary. So I'll start by saying my daughter, for the first 6 months of her life, spit up on me every single time she fed. No exaggeration. It can be maddening. You get her a nice, cute outfit, bloop, spits up right on it. You get yourself in some nice clothes, bloop, right out of the mouth on it. So I understand how frustrating this can be as a parent, 100%. So in the world of spitting up, we see this all the time. Some babies are going to spit up, and that's normal. It's normal for them to spit up. They're learning how to pace their feeds. They're learning, okay, this is what being full is like. I probably don't need more. So it's not necessarily abnormal for some babies to spit up. When we as pediatricians, or myself, and dealing with a kid that spits up, if you have a concern, first and foremost is they need to come see us, because I look at a number of different factors. The most important thing I like to look at is their growth. Are they growing appropriately? For the most part, if you're spitting up more than you're eating, you're going to have a tough time gaining weight. So always need to look and see if they're growing. And then we start kind of teasing out that story a little bit. Are they uncomfortable? How does that abdomen feel? What is the nature of the spit up? And as we start deciding those things, sometimes it's as easy as let's adjust how we're feeding them. Sometimes it is dietary eliminations and our breastfeeding mamas. Occasionally it's a formula switch. In general, you want to be careful just flipping back and forth between formulas without talking to your pediatrician, because sometimes that can make matters worse, of course. Sometimes we thicken feeds in certain situations. But again, there is a lot of different factors that you look at before you make any of those decisions. And that's what we do all day, every day, is look through that story, look at that growth, and decide the best plan of action. But again, if you have concern, number one thing is let the child be seen. We need to make sure they're growing. But is it normal to spit up? Yes. Sometimes, however, we find things that we need to address and fix. But my daughter, kind of to circle back, she spit up every single time, but she was happy. She was growing. So we kept an eye on her and she stopped. Usually they're going to outgrow it, but let me or your pediatrician take a look at everything to make sure that it is that simple, benign spit up that Babies do. That's why burp cloths are such a great industry right now. It just happens, but that's okay. It was a lot of fun. Thank you guys for sending those in. As always, if you want to learn any information about me or Pediatric Associates of Savannah, you can visit our website at PedSav.com or find our office on Instagram or Facebook.